Welcome to Mom Care Month 2. You are now in the second month of caring for your baby and approaching the 6-week mark after your baby's birth. Some physical milestones your body goes through this month include your uterus returning to its pre-pregnancy size, and bleeding may have stopped if you had a vaginal birth. You may be getting ready for your first outing alone with your baby for your postpartum appointment with your obstetrician. This may be the first appointment that the focus has shifted from your baby to you, which may be a new experience since the birth of your baby. At this time, you may be getting anxious to return back to some normal pre-baby routines. Additionally, you may be feeling anxiety for other reasons, which can be a symptom of postpartum depression. This module will address the following topics and questions: an overview of your changing hormones, a nutrition focus on fiber, caffeine, and alcohol, considerations regarding exercise, and finally, some tips to help with hunger. An overview of your changing hormones. Just a short while ago, your body had an incredible transformation. For 9 months, your body was carrying and preparing for the birth of your baby, and in the first month of your baby's life, your focus is on the care and nourishment of your little one. As you are beginning to learn and know your baby's habits, there may be a natural shift to focus on your own body and mental health. The hormones that helped prepare our bodies for birth and caring for our baby are still changing, and you may be feeling the impact of those. Postpartum depression affects between 7 and 20% of women. Although there is no definitive association between specific hormones and postpartum depression, some hormones that may be affecting your mood include cortisol, thyroid stimulating hormone or TSH, and prolactin. Sleep, which may still be lacking, also affects these hormones, so mood changes may be even more exacerbated. One of the more studied hormones related to postpartum depression is cortisol. Cortisol is a glucocorticoid, steroid hormone, synthesized from cholesterol and released from our bodies during stress. During pregnancy, our bodies secrete 60 to 700 more levels of the hormone that releases cortisol compared to before pregnancy, and during pregnancy, our bodies become more sensitive to emotional factors, which can contribute to a rise in cortisol levels as well. Some studies suggest that this hypercortisolemia may lead to a risk of developing postpartum depression. The other suggested mechanism behind cortisol and postpartum depression is the other spectrum hypocorticolemia. Essentially, our postpartum bodies are falsely lacking the amount of cortisol due to the sharp decline that happens after giving birth. TSH, or thyroid stimulating hormone, is a neuroendocrine hormone influenced by sleep and the circadian rhythm. Other factors that affect TSH are the sleep-wake transition and social stimulation, both of which can be dramatically different during the postpartum period. If you are showing signs or symptoms of postpartum depression, your physician may recommend a blood test to evaluate your TSH levels. Some signs and symptoms of postpartum depression can include depressed mood, difficulty bonding with your baby, overwhelming fatigue or loss of energy, severe anxiety and panic attacks, and feelings of inadequacy. You may feel some of those symptoms are a natural part of having a newborn, so it is important to have a conversation with your physician or obstetrician if you are experiencing any signs or symptoms. A nutrition focus on fiber, caffeine, and alcohol. If you are not feeling like yourself for another reason, like constipation, you're not alone. Many women experience constipation after the delivery of their child for several reasons, including a healing body, stress, not enough fluid intake and a change in diet, less physical movement, medications, and postnatal vitamins. The act of carrying and delivering a baby with the excess weight, pushing or receiving a cesarean can result in hemorrhoids and episiotomy, stitches, and even damage to the pelvic floor muscles, making you subconsciously not want to push to the bathroom, avoid further pain. Cortisol, a hormone you are now familiar with, increases during times of stress, anxiety, and lack of sleep, which you may still be experiencing. This stress hormone can also contribute to constipation. As you are nurturing your little one and taking opportunities to rest yourself, you may find yourself being more sedentary, which causes our muscles to become lazy, including our intestinal muscles. And finally, some medications you may be taking for pain or to help replenish your iron stores can have a side effect of constipation. When it seems like everything is working against you in this area, there is a nutrient that can help: fiber. Fiber, along with water, is a key nutrient that helps keep our digestive tract healthy and functional. It bulks up the food we digest and decreases the amount of time food is in our digestive tract to help keep us regular. The next part of this section may be difficult. How do I increase my fiber intake when I am too tired or don't have enough time to cut up fruits and vegetables, let alone take the time to chew them? There are some simple solutions to help you increase your fiber intake to provide you some relief. 1. Consider buying pre-cut fruits and vegetables at the store. Although this is an added expense potentially, you may be actually saving some money because you're no longer throwing away produce you didn't have a chance to chop and cut up and consume. Having pre-cut fruits and vegetables in your fridge helps provide convenience for you just to grab and go for a snack or throw in pre-made lunches for the week. Look beyond fruits and vegetables for fiber. Fiber can be found in oatmeal, chia seeds, beans, and whole grain products. Consider making overnight oats before bed to have ready for breakfast the next morning with some berries and chia seeds added to them. Want a quick snack? Throw some oat-based granola and chia seeds in yogurt. Consider adding a fiber supplement to your daily regimen. Whether it is one you stir into your water or one you chew, adding a fiber supplement to your daily regimen can help you get to the goal of 25 grams of fiber per day. For great overnight oat recipes, check out Overnight Oats Recipes Handout. And for a personalized review of your current dietary intake, be sure to schedule an appointment with your NutriVantage coach. During your pregnancy, your focus was feeding your body with the proper nutrients to adequately nourish your growing baby. Now that you may be feeling more comfortable with your routine, you may be looking forward to adding some things back into your diet like alcohol and caffeine. Even if you are not breastfeeding, it is still important to limit your intake of both. For most breastfeeding women, it is recommended to consume no more than 300 to 500 milligrams daily. For reference, 1 cup of coffee has approximately 95 milligrams of caffeine. For more references on common levels of caffeine, check out the Caffeine Content in Common Foods handout. As a breastfeeding mom, watching caffeine intake is important because of milk transfer to your baby. Caffeine appears in breast milk, with the peak usually occurring about an hour after consumption. Excessive coffee intake, defined as 450 milliliters or more, can also decrease breast milk iron concentrations, which can result in mild iron deficiency anemia in your breastfed infant. Watching caffeine intake for reasons other than breast milk transfer is important for all moms to consider. As you are reintroducing caffeine into your life because, well, let's face it, you're tired, you may be noticing new pains you haven't experienced before. When we consume stimulants like coffee, the ducts in our breasts can swell and give you discomfort. If you are noticing pains and aches in your breast, try to limit or eliminate your caffeine intake to see if it alleviates any pain. High doses of caffeine can also affect your mood. So, when you are already vulnerable to mood swings, try and control caffeine consumption, which can cause tension, nervousness, and anxiety, especially in the more highly fatigued individuals. During your 9 months of pregnancy, you may have been missing out on brunch with your friends or a glass of savory wine with a meal, and now you are ready to get back to those pre-pregnancy activities. If you are breastfeeding, though, you will need to watch your alcohol consumption in order to prevent any transfer to your infant. Alcohol levels are typically found to be the highest in breast milk 30 to 60 minutes after consuming a beverage and can be detected in breast milk for as long as 2 to 3 hours. And the more you consume, the longer alcohol will be detected. An easy calculation would be 2 hours at minimum for every 1 drink. 1 drink is considered 12 ounces of 5% ABV beer, 8 ounces of 7% malt liquor, 5 ounces of 12% wine, and 1.5 ounces of 80 proof liquor. This also means that the pumping and dumping technique does not work to rid your body of alcohol after drinking. However, There are other considerations, including how quickly the alcohol was consumed, whether or not food was eaten, how much you weigh, and how quickly your body breaks down alcohol. For non-breastfeeding women, limiting alcohol consumption should still be recommended. Alcohol can impair judgment, and if you are the only caretaker for your infant, it may affect your ability to properly care for your little one. Some other short-term side effects of alcohol also consider trouble concentrating, loss of coordination, mood swings, and the sensation of wanting to pass out. The best approach to alcohol is to drink in moderation, which is 1 drink per day for women. Getting back into exercise. Some of you may be looking forward to the 6-week mark to begin exercise and looking forward to getting your pre-baby body back. Although you may be safe to return to exercise this month, it is important to keep in mind that your body is not fully restored to pre-pregnant physiology until 6 months postpartum. So be patient with yourself and do not expect immediate results. Although there are some precautions to take when starting to exercise again, there are also plenty of benefits, including improved energy, mood and sleep, improved abdominal strength, and decreased risk of blood clots. Exercise may also provide the much-needed self-care time you've been craving. Be sure to begin slowly and watch for any warning signs such as pain or increased vaginal bleeding. If you're breastfeeding, pump or offer a feeding prior to working out to avoid discomfort, engorgement, or if you are planning on doing an intense workout, your infant may be turned off by the lactic acid in your milk if you nurse afterwards. Always be sure to speak with your physician before starting any exercise routine. For more tips on exercise after pregnancy, refer to the handout, Exercise After Pregnancy. In this final section, you will learn some quick tips to help with hunger. 1. First, assess your hunger. With so many emotions going on, it may be easy to identify stress, tiredness, and thirst as hunger. Try drinking a glass of water first and then reassess if you are truly hungry. 2. As mentioned in Mom Care Month 1, concentrate on choosing whole grains when eating carbohydrates as a general rule. Whenever you eat a carbohydrate, be sure to pair it with a protein. This will help keep you fuller for a longer amount of time. 3. Batch cooking can be your friend. Use a muffin tin to make egg scrambles, mason jars for salads and oatmeal, and baggies for pre-portioned trail mix. Anything you can make ahead of time and grab when you're hungry will help alleviate those pangs and keep you satisfied. 4. Keep easy to grab protein-rich foods around, like string cheese, hard-boiled eggs, cottage cheese, nuts, peanut butter, and fresh fruit.